Do you have a herniated disc at L5-S1? If you'd like to find out how to treat a herniated disc at L5-S1, then this video is for you. I'm Dr. Dave Candy, and in this video I'm going to tell you why the L5-S1 level is one of the most common places where people get herniated discs, and some things that you can do to help treat the pain without needing surgery. Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you get notified of our future videos. So first of all, why is L5-S1 one of the most common places that people have herniated discs? It's usually either L5-S1 or L4-L5. But if you picture your spine like a stack of blocks that are stacked up on top of each other, where are you going to have the most stress? Well, it's the blocks at the bottom of the tower that are getting the most pressure from everything else above being stacked up on top of it. Now compound that with the effect of your back goes from being a concave curve to a convex curve at L5-S1. And for some people that's a very sharp angle, especially if they tend to have a little bit more arch in their back. So that puts a lot of pressure on the discs and the nerves and the joints at the L5-S1 level, and makes it one of the most common places that people have herniated discs. Now, what are the symptoms of a herniated disc at L5-S1? Now, the common symptoms that people have are pain in the back, in the buttock, or in the leg, or even down into the outside of their foot or into the top of their foot. Those are the most common descriptors of the location of pain. But really, what the pain stops you from doing is the primary thing that you're going to use to determine how you treat it. For example, the type of pain that bothers you most when you're sitting, or the type of pain that bothers you most when you're driving the car, may have a very different treatment, and actually maybe even exactly the opposite treatment as the type of pain that bothers you more when you're standing or walking. If your herniated disc keeps you from sleeping comfortably at night or makes you toss and turn in bed, there are some other treatments that help out with that. So really determining the right treatment for the pain that you're having depends mostly on what the pain stops you from doing. Now, you might think, if the disc is herniated, wouldn't I need surgery for it? And that's a common belief that people have, but usually your body will heal a herniated disc within about a year or two, but it doesn't mean you have to wait that long for the pain to go away. You can actually do a lot of things on your own. And in fact, doing the things that you want to get back to doing, whether that being more active, whether that being exercising, whether that being playing with kids or grandkids, or just doing chores around your house. Knowing that being active is not going to further damage your herniated disc can help empower you to get back to those activities, even if they do still hurt a little bit. And in fact, getting back to those activities may actually be part of the solution. That people who stop being active and they either go on bed rest or stop doing activities that they enjoy, they start getting depressed. And depression is one of the major risk factors for chronic back pain. So actually getting back and doing the things that you love and that you feel your back pain is stopping you from doing can be a big step in the right direction of getting the pain to go away. And that herniated disc will heal over time if you give it the right treatments. But there are lots and lots of people who live with herniated discs in their back and have no pain at all. Now, if you'd like to get some help for a herniated disc at L5-S1, just contact us at More for Life and we'd be happy to help. Now, if you find this video helpful, give it a like or thumbs up and subscribe to our channel so you get notified of our future videos.